I'm Debbie Danforth, the Oneida Comprehensive Health Division Director, and today I just want to talk a little bit about the planned Oneida Comprehensive Health Division Integrated Campus Project. The campus project has been something that we have been planning for a number of years. We've looked at various options in terms of how we can continue to meet the demand for the community, but we're at the point now where we don't really have any other alternative at this point. We've actually maxed out the space. And similar to what we were experiencing before we moved into this facility. We moved in on November 2nd, 2002 into this facility. It was 67,000 square feet the day we moved in. Prior to that, we had actually planned for about 115,000 square foot facility, but because of funding cuts, we had to downsize to be able to meet the budgetary restrictions for that facility. We did have plans for population growth that were worked on with this facility. So we planned 5, 10, and 15-year population growth projections. And the day we moved into this facility, we had already surpassed the 15-year expansion, the 15-year projections for the population. So we were already outgrowing the facility before we moved in. So the day we moved in, we already needed to look at how we could continue to look at options for meeting the demand and access to care for our population. So just to give you a little bit of an idea in terms of how that growth has occurred, when we moved in, we were anywhere from about 175,000 to 200 visits of patient visits per year when we moved into the facility. We're now at approximately 375,000 visits per year of the population that we're serving. So to say that we're increasing in size is just, in a nutshell, we've surpassed that. And so we are at the point where we have to look at various options to try and continue to meet the demand of the community, continue to meet the demand for access to care. And so in order for us to do that, we have to have the space to be able to do that, to be able to look at options in terms of how we can maximize the use of our space. We've converted, again, in areas in this facility now, we've converted areas that were not originally designed as patient care areas. And so we've moved our clinical space into those areas and move the non-clinical space into areas such as our health information lab, where we had computers for training. We've had to do away with that, go to alternative methods for training, and convert that space to accommodate additional needs for staff. When we moved into this facility, we were about between 180 to 200 staff for the health division. We're now at about 373 staff for the health division, and that puts a burden on us in terms of trying to identify spaces. In the old building, we brought in trailers in the parking lots, and we want to avoid that if we can. And so part of the plan is that if we can maximize the space that we have, we can improve the continuity of care and the services that we're being able to provide to the Oneida community. So demand for space has continued to be an issue for us probably the last, I want to say, at least 10 years now, that we have looked at various options to try and accommodate the demand. One thing that we're also looking at right now is looking at how we can increase the demand from the community for access to care to include expanded hours. So we're looking at how we can expand hours and still meet the demand for space by adding additional staffing. So we're looking at evening hours. We're looking at the potential for weekend hours. So looking at various options to try to continue to look at how we can meet the needs of the community.